and welcome. You are watching The Island Docs. I am Dr. Sandy and this is my co-host Dr. Gordon, and we're here to talk all things health and health related. Today our topic is depression and suicide. And depression and suicide are as real as any other disease or disorder. So we in the Caribbean need to recognize what it means to be depressed and to attack it just like we would attack a heart attack.
Yeah, so depression is one of those diseases that people from the Caribbean don't really take seriously. You know, someone comes to you and they tell you they're depressed. They think it's a thing that has to do with strength, character, something that's a deficit in their upbringing. They don't understand or realize that this is a real disease with real symptoms that affect you in a seriously. So now I'm just going to give you a few pointers of what is depression. So depression is when you have a general sadness. You have a loss of interest in things that usually would make you happy, things that would make you pleasurable. You can have weight changes. What I mean by weight changes, you can actually have weight gain or weight loss, because sometimes you have changes in appetite. If you start, some people treat their depression by overeating. And if they do, then you're going to have the weight gain. And some people just don't eat at all.
Yes.
And in that case, then you can suffer from weight loss. Besides losing interest, you can also have sleep disturbances.
Exactly. You could have insomnia sometimes.
Right, and psychomotor agitation. So what that simply means is that mentally you're unstable, you're not doing well, you're unable to have
perform all your functions
right,
like normal.
Your interpersonal relationships with your family, your friends, it starts affecting your work, your job. It starts affecting just the way how you interact with people. You start having decreased energy and a feeling of worthlessness. You can't concentrate. Some people, when they're depressed, it comes over them like a fog. They can't find their way out of it. It's just a feeling of complete hopelessness. Some people, they feel so depressed that they consider suicide, and suicide seems like their only way out.
Yeah, suicide is definitely one of the risks of being depressed. And suicide itself has its own risk. Being male, you're more likely predisposed to committing suicide. Being elderly, because, you're socially isolated. If your family and friends are not close to you, you have low job satisfaction. These are the people, you have to keep an eye on, because these are the risk factors for suicide. Some are, you've been divorced, you've lost a husband, you've been widowed, your finances have taken a turn for the worse, so suicide and depression are linked, and it kind of compiles one on top of the other. It's all mood disorders. It's all something that we see all too often in the hospital, of people who are suffering from depression, who are suffering from these mood disorders that they can't really get out of the funk.
So it's what we're really trying to say is that patients or people who are suffering from depression, and you're feeling that this sad type of isolated, you're feeling very, very somnolent, what we need for you to do is to try to reach out to somebody. Try to reach out to someone who can help you through this bad time. We want to break that stigma that exists in the Caribbean, that once you are sad or depressed,
you have low character, you don't have enough strength.
Right, or it's in the Caribbean, it's either there's two definitions. It's either you're crazy or you're mad or you're sane. But that's not how mental health or mental illness work. There's a whole different spectrum of mental illness. So you need to understand that if you're not feeling very, very well mentally, you need to go and see somebody, speak to somebody about it. There's different treatment regimes that we could get into to make you better.
Yeah, it varies from like group therapy, or as an outpatient, or even some individual therapy on one-on-one basis, to medications, to ECT. The level of treatment is based on your level of symptoms that you have, and we don't want anybody out there, or any viewers, or any family members that you have, to feel ashamed that they are going through these signs and symptoms on a day-to-day basis. They have to know that people do get depressed, and it's better if you come out, talk about it, and seek help.
And I also want you to understand that there's a difference between depression and grief. I mean, grief has some type of agitating event, loss of a loved one, loss of a job, or something like that, that can make you very, very sad, and sometimes it can feel like depression. However, grief is a situation where there are moments where you feel really, really sad, but there are also moments when you are feeling okay. So you are moments when you can experience humor, you can continue to function. It's a matter of functionality. So even though you may be going through the grieving process, you are still able to go and continue to do your job. You're still able to take care of yourself. You're still able to maintain proper hygiene. You're still able to continue to do the things that you're accustomed doing and still live almost a normal life. And have moments and episodes of just reminders of this stressful event, which can make you teary-eyed. Depression, on the other hand, there is no respite. It's a constant, total feeling of sadness, of worthlessness, of just not being well. So there's a big difference between depression and grief. The other thing is time. During grief, there's a time period of feeling sad and worthless, but as time goes by, you feel better. The passing of a lost one, you get over it. But depression, without the correct treatment, without the proper support in place, this is one of the things that you just really, really cannot really get over.
We're going to take a break now, but when we come back, we're going to continue our discussion on depression and suicide. We're going to meet a guest who's battling with her depression. We're going to hear a little bit about her story. We are going to give you tips and ways to help, how to identify the signs and the symptoms in your personal family members and friends. So definitely stay tuned.